Well, if you're one of the thousands of people who've been treated at an urgent care center, you will not believe what 2 News Investigates has uncovered. Natalie Tendall finds a lack of regulation and oversight for some of these facilities in Ohio.
Urgent care centers are becoming more and more popular because they're cheaper and quicker than some doctors' offices and emergency rooms. But the lack of oversight they have in Ohio had even lawmakers I talked to surprised. This picture has people talking, but it's where it was taken that has people shocked.
I'm shocked that a facility like that would be allowed to serve patients in the condition that it was in.
Stephanie Shanking snapped this photo while waiting for an x-ray at Access MD's Urgent Care Center at 540 West Central Avenue in Springboro. She took her son Anthony here after he hurt his finger at football practice earlier this month.
It looked like some sort of fluid was splattered on the wall and had not ever been cleaned.
She says the staff sent them on their way, saying Anthony's finger was not broken.
4 days later, my family doctor got a hold of the x-rays, and in fact it is broken.
She took her concerns to 2 News Investigates.
Hi Mike, this is Natalie Tendall with WDTN. How are you?
I called the Director of Business Development for Access MD Urgent Care, Mike Horn. He didn't want to answer questions or show us the facility on camera, but told me over the phone they just took over full operation of the business in August, and the room in this photo is not supposed to be open for patients. He said they're in the process of converting it into a storage closet. He said the rest of the center is clean. As far as the possible misdiagnosis of the broken finger, he says the physician ordered further tests and alerted Shanking as soon as the test results were conclusive. She said that didn't happen. But who's checking out this center and others like it, making sure it's safe for patients? After digging through state laws and calling state health agencies, 2 News Investigates found there are no inspection requirements for urgent care centers like this in Ohio.
Well, that's scary.
This doesn't mean all urgent care centers are not inspected. We found the ones affiliated with hospitals are accredited. That means they follow certain standards of care and are inspected. The same goes for walk-in clinics like those in Walgreens, CVS, and Kroger. I checked, and they're all accredited. But some of the independent and franchise ones, like Access MD Urgent Care, are not. And they don't have to be. There's no law requiring it. Restaurants, schools, and even hotels are inspected by the state. So I wanted to know why there are no laws in place for centers that are seeing and diagnosing patients every day.
When you're dealing with the health and safety of our families and our children, then you ought to expect a certain amount of regulation from the state or the federal government.
I took my findings to Senator Shannon Jones, who's from Springboro and is the chair of the Ohio Senate's Medicaid, Health and Human Services Committee.
I found that urgent cares are not really regulated. Does that concern you?
Well, listen, it certainly raises some big red flags for me. I think that as healthcare is changing so rapidly, there may be some areas of the law that we have to take a better look at.
Senator Jones says there are inspections for x-ray machines, some labs, and outpatient surgery centers, but she didn't know there were not rules for urgent care facilities. She says since it's becoming a popular form of healthcare, state legislators may have to look at the law to see if there are gaps that haven't caught up with the change. Shanking says from now on, she'll be doing her research before going to any urgent care.
But they're not regulated, and that's not okay.
Senator Jones and Senator Bill Beagle tell me they'll be looking into the laws. As far as Access MD Urgent Care, they recently registered their x-ray machine with the Department of Health, which means they have to follow radiation standards. They're up for an inspection for that before December. Natalie Tendall, 2 News Investigates.
And if seeing this makes you curious about the urgent care centers in your part of town, go to WDTN.com and look for this story. We've also posted some helpful links where you can see if your center is accredited. And lawmakers are now taking action after a 2 News investigation exposed little to no oversight of independent urgent care centers. Natalie Tendall went to Columbus today to follow up on the concerns of one Springboro mom.
2 state senators told me they'd look into urgent care regulations. And today I came to Columbus to check on their progress and found the director of the Department of Health is weighing in on the issue. It's an issue 2 News Investigates first brought to your attention after a Springboro mother came to us with concerns. She showed us this picture of a dirty local urgent care center and said they misdiagnosed her son's broken arm.
I'm shocked that a facility like that would be allowed to serve patients.
2 News Investigates uncovered there is no oversight on urgent care centers throughout the state. Facilities associated with hospitals or grocery and drug stores are accredited and inspected, but some of the independent and franchise ones are not, and they don't have to be. There's no law requiring it. We alerted State Senator Shannon Jones about our findings in September. She's the chair of this Medicaid Health and Human Services Committee and a resident of Springboro. She promised 2 News Investigates she would review the issue. Now she has.
Those minutes will stand as approved.
During a confirmation hearing today for Ohio's new Director of Health, Rick Hodges, Jones took the opportunity to ask him about it.
One of the issues that has been brought to my attention, and I'm curious about your thoughts on this, if you have any, is the issue of the oversight of our urgent care centers.
Hodges says while several aspects used in urgent care facilities, such as x-rays and labs, are regulated by the state, he's open to looking at what can be done with the entire facility.
Certainly, if the legislature would like to pursue that, we will be happy to assist in the assessment of different strategies.
Senator Jones says with more and more of these urgent care centers popping up, it's important to look at all the options to keep health care safe for patients.
I think that the director seems open to wanting to understand the concerns and to see if there's a way to address the concerns while balancing, the burden of over-regulation.
Now, Senator Jones says the conversation's not over yet. I'll keep checking back and let you know what happens. In Columbus, Natalie Tendall, 2 News, working for you.
And it was a viewer who originally contacted us after she had some concerns with her urgent care. If you have a story you would like us to look into, send an email to 2newsinvestigates@WDTN.com.